There you go. All right. Am I good?
You're looking good. All set.
All right. All right, everybody. We only 8 minute delay this time opposed to 20, so that's not bad. We're getting better. I want to continue this series on how we use SportGait in a more athletic environment beyond what we do with concussions. And today we're going to talk about symmetry as strength and how we identify overuse risk. And I'll talk about what that means here in just a minute. And there's the famous photo of my son who I will continually throw under the bus. Again, just to review where we've been, the whole goal of these webinar series is try to reframe how you think about SportGate, how you use it, and to help you realize that you have an incredibly versatile tool in your phone that can be used for in a variety of tasks as you interact with your athletic population, whether you're athletic trainer at a school or a clinician or a physical therapist, whoever you're interacting with. There's so much more to here than just a baseline. Um, the idea is to show you some of the ways that I've used it, to give you something that you can leave these webinars with and go back and dive into what you're doing or already done, or go back and look at athletes. And I hope as we go through, again, these objectives haven't changed as we go through all this, get you excited about what we can do with this. And we've talked about what we find in a baseline. And when we have situations where we have indicators, and we've all seen this, we've done baselines and we've had indicators show up, either they're little red exclamation points or yellow ones. Those are chances for intervention. Those aren't just to be ignored and put back into your pocket with the phone, hoping that you don't have to use them if you have a concussion. Those are opportunities for intervention. And I think particularly if we're talking about youth athletes, high school athletes, um, as an athletic trainer, particularly in schools, every interaction you have with a youth athlete is an opportunity for an intervention. It's an opportunity for you to really make an impact on that young athlete's life, whether it's about hydration, nutrition, sleep, working out, emotional health, mental health, mindset. It's always an opportunity. So when you see those indicators, it's another opportunity to interact and find something. Hopefully, we'll be giving you some gold nuggets through here to enhance those moments of interaction so you can be really impactful and be an important part of the athlete's career, no matter what level they're at. We've talked about how movement is uh, posture and motion, and when you start to move, the brain needs to coordinate with that, and that's what we call gait. Gait is very predictive. We can use it to flag injuries, look for imbalances, like we've talked about. Using sport gait becomes very objective, unlike when I'm watching somebody walk and I'm doing a gait assessment with my eyes. That becomes very subjective. It's dynamic. It changes with fatigue, recovery, injury, and it's integrative. I can combine the gait with the cognitive test, and then I can integrate it into any sort of interventions that I want to develop for this particular athlete or health and wellness client, even. So, with this in mind, you can use gait as a vital sign, and I've always used it. I'm not claiming to originate the term, but gait is the sixth vital sign. It can give us some really great insights into how your body and brain are working together. And the way that we all know from working with athletes is athletes don't really break because they're weak. They break because they're compensating for something. And usually we can find patterns with SportGate and what that compensation may be and how it's working, overworking, or underworking. We find it. And through that, we use indicators like imbalances, asymmetries, fatigue drift, which would be another we've talked on a little bit last week, and cognitive motor mismatch. So we take those sort of patterns and overlay them on what we're talking about. We can get some really great insights into what we need to do for our athletes. So we talked about little nuggets in the baseline. We just don't do a baseline and put it away. It's a chance for intervention. Last week we talked about fatigue, and that was where we discussed how athletes perform under stress when they're at the end of a season, in the middle of a season, under increased load. We talked about sleep deprivation, whether it be from travel or just school load and trying to balance work-life issues, life, school, sports issues. I'm using it to pick up on fatigue. Today we're going to use it in a different kind of fatigue, in an overuse way. And just to remind you of what we're going to look at when we measure a gait with the SportGait app, we're looking at power, stride, stability, and symmetry. And with each one of those components, hopefully this is all review, we can break those down into smaller components that we can use to tease out details of where we may be at risk in this particular athlete. So power, we're looking at striking force and pushing force. How hard do we hit the ground, and what's our ability to propel our weight up off of the ground? Stride, what's our stride time? How much time do we spend in stance phase? How much time do we spend in swing phase, which is something I'm kind of getting very interested in because it's when I think we're at our most unstable. Double leg stance phase. Each of these metrics will give us a hint on what's going on with the stride. Stability, we're looking at sway here. We're talking back to front to side, and various phases of the gait when we're more stable and less stable, like a double leg stance versus a swing phase. And that all sort of gets overlaid into the symmetry uh, metric, which looks at power, stride, and stability, kind of puts those together into a integrative metric on how stable are we moving, how's the left leg moving compared to the right leg when we put all those power, stride, and stability things together. So we've gone through these, we've looked at them, at what they look like when on a baseline, how we can tease out nuances. We looked at it in fatigue and how that combines with cognitive issues with increased variability. Today we're going to talk about symmetry. And we hinted at it a little bit last week when we talked about fatigue and the underpowered leg really taking on a lot of the load when an athlete gets tired. Um, so this today we're going to talk about symmetry and kind of when the dominant leg is being used too much, um, and why this symmetry really matters is a picture of a blown out hamstring. That's why symmetry matters. We're trying to prevent these things, and I really have the philosophy that acute soft tissue injuries just don't happen. Non-contact soft tissue injuries, they are cumulative. There are things that we can see ahead of time that can allow us to put in some factors that we may be able to help reduce these injuries, reduce the risk of these injuries, reduce the severity of these injuries, or improve the recovery of these injuries if we can find hints in the athlete's gait before the injury becomes a giant hematoma on the back of a hamstring. So when we talk about symmetry, we're talking really kind of about mechanic overload, how one leg is moving differently than the other. I said the injuries are accumulations. And what I hope to teach you in this talk is to show you how we can look at some of these imbalances, particularly in the dominant leg, which is taking a lot of the role when you're not fatigued, and some of the things that can happen there. Um, the body is a great cheater. It likes to lie to you. The brain does not like to be uncomfortable. And the whole entire point of our fight or flight system is to maintain homeostasis, to make sure we're not too comfortable, we're not too uncomfortable, keep us in a state of non-emergency, non-stress. And because of that, the body will always choose the path of least resistance. And for our purposes, that means we may favor one leg due to a previous injury, like the hamstring I just showed you. We may be able to get that hematoma taken care of and get that hamstring strong again. But one thing that happens with injuries like that is you learn new gait patterns. We're going to talk about that as we go through. These are reprogrammed, learned movements. So even though you may recover from that injury, in terms of strength and being able to go back onto the court or the field or to compete again, you have a learned motor pattern that is not optimal. And I'm going to use that word not optimal a lot because there's really no such thing as a perfect gait. We can just try to optimize the gait. So one of the great reward systems in the human brain is the relieving of pain. So if you can take away somebody's pain, you've given them an incredible reward stimulus. So with limping, it takes away pain. So when you have a hamstring injury or any sort of lower limb injury, you're going to limp, and sometimes that limping gait pattern now becomes the new normal because it's been imprinted through the relieving of pain through the reward symptom. So we may favor a leg due to a previous injury. We haven't corrected a gait imbalance that's there. We may have subtle trunk shifts or timing delays because we don't spend a lot of time maybe thinking about how our core and trunk interact. And I tell athletes, the core isn't just your abs. You don't train your core by doing crunches. You have an anterior and posterior chain that goes all the way up and down. And you have to think about what the trunk is really doing. It's stabilizing during rotation and not just back and forth movements. So there could be issues with trunk. Um, and because we have these things building over time, we may not have an immediate issue, but over time they can develop into other more chronic type injuries. So when you start going back and you look at an athlete who's had a hamstring injury or a calf injury, um, we were doing uh, Birmingham City. We had the first year I was out there, we had an epidemic of calf injuries. And when we broke down movement patterns, we could see exactly where they were happening. There were trunk problems, glute problems, hamstring problems, just not activating certain muscles. Every one of those injuries told us a story in retrospect. So when you start seeing athletes that have these injuries, think of what happened leading up to it. What was, what kind of their aches and pains or different complaints the athlete may have had. If you use SportGait, you'll know the story immediately. You'll hopefully will see it coming, and will be able to prevent it. But every injury is going to have a story, and if you take the time to act like a detective or an investigator, go back and really dig out where some symptoms may have started to occur, you'll find that the injury was talking to you for quite some time. Um, Symmetry in a healthy athlete. We're going to show a wide range of athletes here, and I get to the cases in a second. Symmetry is a dream. It's matching vertical power of left and right, balances left, right, center. We have stable waveforms and speed and velocity, and we have very little medial lateral sway. And as we continue with these webinars, you're going to hear me talk a lot about medial lateral sway as a risk factor for a number of different injuries and how that medial lateral sway sort of will decompensate from the trunk down. And so when we're not able to have good core activation or good core strength to help with the rotation that happens in normal gait, when you think about the serpentine motion of the inverted pendulum of gait, how our trunk and glutes, glute medius and minimus are going to help compensate for those movements. So we try to look for, is the left the same as the right? And as best as we can get. Like I said, there's no perfect gait, but there are optimal gaits. And so the things that you start to look for is one leg doing too much. Last week we talked about when an athlete gets tired and the leg that's doing too little work starts to overcompensate and can be a site of injury because the dominant leg is getting tired. We're asking that fatigue leg to do too much. We've exhausted some of our cognitive reserve, and so the weak leg is getting too much and too much load. When you have an athlete who's at the beginning of a season or you know not really at a fatigue level, if you're not interrogating for fatigue, then we obviously pay attention. We want to strengthen the weak and the strong. But when you start looking at the dominant leg, and we start looking at different red flags, basically what we just talked about, medial lateral sway is a big one for me. Shortened steps, delayed steps, decreased power. We're going to see leans to one front or back or one way to the other with these athletes. And the body, like I said, will cheat. It takes the path of least resistance. It's going to shift from that when we're in that non-necessarily fatigue state. We're going to shift from the weak leg and put a higher load on our dominant leg. And because of that, we're putting a lot of strain on our trunk to compensate for what our weak leg isn't doing and trying to help that dominant leg take over um, for the weaker leg. And that pattern begins to appear before we see pain. And so we'll see, like we said, medial lateral sways, back and forth sways, trunk leans, all these things talking about how the trunk is going to compensate for going to be the cheat code really for the imbalances between our left and right legs. We'll see that with over fatigued athletes too, whether the cases we talked about last week, but we're going to focus here on this. When you have a dominant leg that's doing too much and a weak leg that is sort of lagging behind in an athlete that isn't really complaining of any injuries, not really fatigued, you'll start to see these really chronic things happen. You'll see patellar tendonitis, shin splints, hip flexors are going to get tight. You're going to start having some hip flexor strains. And you'll see contralateral calf tightness. And these are all things that we see every day, and we just sort of blow them off. We try to treat the pain opposed to treating what's causing it. Right? If you have a really objective test like SportGait, where you can go in and I can see, hey, I've got your trunk lean is here. You're using your trunk rather than your hip flexors to swing your leg around. We're setting ourselves up for back pain. We're setting ourselves up for all kinds of different things because we're compensating. It's these little nagging injuries that come up that we think it's because, oh, we're just overusing, we're working too hard, we're training, we're going to decrease load, we're jumping too much. When actually we're not. We're doing the right amount of load. We're just compensating for imbalances in the left and right leg. So changing load may not be the best strategy in a situation like this. It may be identifying which is the weak leg, which is the strong leg, and then doing some single leg work to try to catch those two things up. One thing that this is a tangent thought that I just thought of as this slide was up, but I had this conversation with an athlete yesterday. We were doing some Pallof press band rotations and in a split stance. And the cue to the athlete was we were trying to work the core. If you start to feel um, the muscles getting tired or burn in your glutes, hamstrings, or calf, we're not using our core, and we'll have to change how we're doing the exercise to make sure that we're hitting our core, because all of that force, that stabilization tension, is going to be transmitted down the lower limb, which is why we have so many calf injuries or hamstring injuries in a real running sport. It's because a lot of times the core is not really activated. So when you start seeing these things, take a minute, pause, take a peek at your athlete, do a SportGait, and see where you are. And the beautiful thing about SportGait is, I can do it anytime. It takes 12 minutes. I can do it every day with somebody if I want to, and it really gives me great data points to know if these nagging injuries are a problem. One thing about shin splints, and I don't know, and it's an anecdotal story. I had this rash of shin splints and some athletes, and it was really strange. I've never seen that many shin splints in a week in my life. And what I found out was that some of these younger people were putting pieces of plastic in their sneakers to prevent the sneakers from creasing, and so they didn't have any um, dorsiflexion or plantar flexion in their feet, and they were just walking around shuffling all day, and that put a lot of strain on obviously on the anterior tibialis. And I was like, well, first thing we got to do to get rid of your shin splints is we got to take that plastic out of your shoes. So you're gonna have to wrinkle up your sneakers. So weird things too sometimes pop up. Where to look? We're going to go through some of these cases. We're going to talk a little bit about post turn power. That can be the turn is something we'll get into in really great detail because there's a ton of information you can get out of the turn. Because that is when you are at your, I think, absolute most unstable position in the gait test. So we can get a lot of information out of there. We're going to talk about sway, medial lateral asymmetry sway. We're going to look at stride tracings and the separation between the left and right leg. And then our symmetry summary charts that we have looked at last week. When we think about the brain, we talked about this a little bit particularly with fatigue, because when an athlete is really tired, remember it's a whole body process where you've got an increased load, whatever their demands are, and the executive function centers of the brain are just not doing their job. That trickles down into not being able to maintain proper gait mechanics during walking and then during athletic competition. So we'll see a lot of attention issues with fatigue, poor planning, increased variability. These are things we talked about last time. Hit standard deviation, hit response time, standard deviation, variability is a big one for me. And I put ISI change because I always forget that it's interstimulus interval. I always forget exactly what that acronym is, but it's the lag response between the stimulus, which is another thing I'll look for in fatigue. We might not see these in athletes, particularly this time of year where we're gearing up for fall sports, and everyone's kind of and fall sport athletes are in their off season and doing what they're doing. But we may see these because some of the athletes may be doing 2 or 3 workouts a day. And I have athletes that are doing, weights in the morning, speed and agility in the afternoon, and then position-specific drills in the later afternoon. So looking out for fatigue in them as well as looking for these sort of compensation mechanisms we're going to talk about will be important. So don't forget that even though we're not talking about a fatigued athlete in the middle of a season, we can still develop fatigue from training demands during the off season. And the reason why the CPT is so important in teasing those things out is because it really hits these areas of how the brain visualizes the outside world. We have our prefrontal cortex that is, this is what I want to do. We have the inferior parietal lobe, which is our motor cortex that's telling us this is how we do it. And then everything kind of goes into the cerebellum where we get input from our spinal cord and down through our motor pathways in our brain, and it kind of get mixed up and synchronizes and goes out into our wanted motor function. Fatigue, attention, executive function. These are all how this happens, and integrated obviously with our visual cortex and how that's all integrated as well. But these are the particular areas that are going to affect our CPT, basically to look for increased variability if you're worried about neuro fatigue in these athletes. Here is an athlete, our first of athlete here, and this is I'm just going to show you. Because I'm doing a little sneaky trick on you. I'm going to show you the symmetry, stride, and balance graph for this athlete who was ready to go back. All the strength metrics are great. Rehab is going fantastic. And if you just sort of eyeball these, you can see that, yeah, if you look at the symmetry, we got a little bit of lag on the left leg. If you look at the stride graph, you can see, I don't know if you can see my pointer, but there's a in the middle where we have the dip around, I can't see that, 0.6 seconds, I think, is we are seeing um, some issues with lag of the left and right leg. And if you look at the balance graph, it looks pretty good. I think we have some really good stuff going on here. We're pretty tight. We got a little bit of back to front sway, but it's symmetrical. We've got just about as much back sway as we do front sway. We're not really swaying medial or lateral, so I don't have a whole lot of trunk. To me, this looks pretty good. Again, we're not going to have a perfect gait. We're going to have an optimal gait. And what this had progressed from, this is pretty darn good. So then we take a look at the power graph, and I hope that you can appreciate just by looking at that is not symmetric. And if you think about some of the other power graphs that we've looked at previously, this is not normal. And what we have is some just inconsistent amplitude. We have no consistent pushing force, weaker striking force. We're kind of really hesitant to step down. And as we go through the gait cycle, you can see it's sort of building up. It's almost like there's a confidence issue with this athlete, which would not be uncommon with some of the psychological stresses that come with returning from an ACL injury. So we're having some delayed recruitment, almost like a warm-up gait. And then even then, once we take the turn, it's somewhere around about 7 seconds or so, or actually about 6.5 seconds. We start to see the amplitude go up. So we're kind of warming up into our gait. But because this is a not a conscious effort, this is a motor program that's being affected by our fight or flight system, our limbic system, where we're thinking about how we're feeling emotionally, things we may not even be aware of. We have an ingrained, trained motor program here that even though we may have very clean symmetry, stride, and balance graphs, we clearly have some problems with power. And this arrhythmic power is a risk for not necessarily a re-injury of that ACL, but an injury of the opposite leg, because we're going to ask that this is a left-sided ACL. We're going to ask that right leg to do a whole lot more stuff. So if you look at some of the statistics out there, people coming back with ACLs and the increase of injuries, whether they're ipsilateral or contralateral, not just of the ligament, but of the lower limb in general, these sort of things can get teased out of athletes. This is not what you're going to see with every ACL recovery that you have in your career. But this is for this athlete. This was the pattern that we had. This was the issue. Why I think power is really important here. And for this athlete, um, it because it's a power is a confidence issue, I think. And your ingrained hesitancy to put strain on that left leg of walking. Imagine what's going to happen then if we take this athlete out to the field and ask them to do full speed drills. You're setting yourself up for a little bit of a problem. My thought on this as well is that some of this is also coming from a place of um, uh, a loss of proprioception where we're not really aware of where that left limb is in space, and so we're asking that right side to do all that other work for us to find where we are, where we're going, and so the right leg is where we have the higher amplitude um, um, pushing forces here because we are really trying to compensate for our left leg not really knowing what it's doing. So some proprioceptive training here was really, really effective. And just to show you again, if we wanted to split hairs, we could say there are some asymmetries here. But based on some of the other stuff that we've seen, this does not look that bad. If we had a pretty symmetric power tracing, I'd be really happy with this. But if you want to get into the nuts and bolts of it, we do have again left side underuse because that's our surgical limb. We're shifting everything towards the right. We have some fatigue in the posterior chain, which I think for this, if you look at the stride, as a proprioceptive lag. So if you incorporate a lot of proprioceptive, which you should be in your ACL rehabs, it takes care of that. So we did some really fun proprioceptive work when we saw this power tracing that really seemed to help things. Not really an issue so much with a glute or a hamstring. I think we were pretty good there, which we see with the clean symmetry. So these things can kind of hide. And if you were just watching this athlete walk with your naked eyes, you would probably miss this. In terms of the uneven power distribution that's there. If we were to leave this alone and do nothing about it, say, yeah, you look great, you've met the milestones, you've hit the force plate metrics, your Nordics are good, all these things look fine. We're going to end up sending them back out. We're going to get an overuse accumulation on that right leg. It's going to break down during fatigue. We're going to end up with calf strains, patellar tendonitis, hip flexor issues, and even contralateral ACL strain, which could lead to an ACL tear because we're asking that right leg to do everything. We're just doing all the proprioceptions, doing all the power, sensing how much force we're putting down, and that response to how much force we're putting down and pushing off, coming up to the brain, being transmitted down to the left leg. That saying, oh, we're covered. We got this covered. We don't need to do as much work. So there's a lack of communication there. And as a result, this kind of learned motor pattern that you have to basically break down and relearn how to push off and strike again with some proprioceptive work becomes really important in preventing these little nagging things that will be really frustrating for an athlete coming back from an ACL. I mean, if you come back from an ACL and you got a calf or a hamstring strain, it's like, my gosh, am I ever going to get back on the field? This is crazy. But we see this. We see this a lot and it's due to the asymmetries that we're having. And it's not a necessarily an issue with you're not a good athletic trainer, you haven't designed a good program. It's just some of these are athlete specific. And it may be, maybe this abnormal gait, maybe maybe a historic thing that put them at risk to have this ACL, non-contact ACL injury to begin with. So, when you find the pattern, and it's not your fault if you train them necessarily, and it's, you maybe something that's historical, but now we have some data. Now we have a way that we can try to make an impact and correct, do some work, and then the next day do another gait test, do some more work, the next day do another gait test, hit that single leg, hit that left leg, get some more proprioceptive work, get some more single leg work in it, and see how your power graph changes. And it gives you a lot of reassurance that you're going to send the athlete out into competition in a much better position than if you didn't have this data. Here's actually, I think, if you were to look at this compared to some of the ones we're looking at, this is a professional dancer. And the one thing here that I say when I show this is that the pushing force, she's very light on her feet. There's not a lot of pushing force. coming off of here. Again, no history, no injuries here. This person is fine. They're just coming in for some just general um, strength and conditioning training. Do the screening. We find that as we go through the gait, particularly post turn, which is at about 6 seconds, we start to see some dominance happening here. We start to see again, it seems to be a right leg dominant world. But we're seeing that there's a little bit of power generation coming to that right leg, and a little bit of a lag on the left leg in terms of its striking force and its pushing force, particularly post turn. And if you think of the turnabout being 6 seconds, again, that 6 to 7.5 seconds, I'm sorry, 6 to about 7.5 seconds, you can see how things start to kind of get funky a little bit. And we'll do some lectures specifically about that phase coming up. But we're starting to see after that turn, we become unstable. The brain doesn't like that. And then we start really exposing some of our compensatory mechanisms. If you kind of cut that graph in half, you'll see that the left half of the graph looks different than the right half of the graph. And not a problem yet, no pain, no symptoms, no issues, but here's something we can work on. If you look at the stride graph, you can see the kind of averages the darker line that goes to the middle, and each stride is a single lighter line, and you can kind of see there's a little bit of separation in that middle point where some of the streaks are higher up and some of the streaks are lower down. We'll see that pattern again in the symmetry I'm tracing, but that's the left leg lagging a little bit behind the right leg. Um, so we're putting a lot of stress onto our right leg at this point in time. We have uneven distribution of force and power and um, through her. The other thing that we have going on is because we have that right leg is taking on all that burden. We're having a little bit. If you think about the one we just looked at with the ACL, I mean, we had a pretty nice symmetric front and back sway here on the balance graph, but here on this dancer, we're having a little bit of a lean to the right because we're putting a lot more weight on our right leg, getting things off our left leg. That pattern in this individual is because we have a dominance. We have a right leg dominant situation, which we would predict we might start to see some overuse injuries, and so we want to try to put in some 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 activation plan and soft tissue work that would try to alleviate any of those soft tissue complaints. The other time you might see this, and if somebody's having a complaint, you might see this with somebody who has a left side avoidance. If they have an old injury, so history becomes important. Somebody may have had an old meniscus injury or an old hamstring. Again, it could be a learned gait pattern, even if they're not complaining of any sort of pain at the time. So taking a history is obviously very important, but it might not be because we're just right dominant. We maybe have learned to be right dominant because we've messed up our left leg at some point in time in our life, and we're developed that pain avoidance gait that's now become our norm. That's now shifting all the problems to our right side. You can see here on the symmetry graph, we can see again, not horrible, but we do have some lag of that left leg, a little bit of shortening from top to bottom and shortening left to right. So that it's slower and not really following the tracing of this really nice right leg tracing that's got a really good peak drop, even nice and smooth. The left leg has a very brisk drop off and lags behind our right. So when you look at it, in a little bit more detail, you can see that's a little bit flatter, a little bit shorter. So again, you can get really complacent with this and say, yeah, it's symmetry, it's enough. It's fake symmetry. The left leg isn't doing what it's supposed to be doing. We're putting too much stress on our right leg. Um, Again, because of this, I would be worried about in this person who we're going to develop a strength and conditioning program for. We're not just going to, do a general kind of thing. We're going to do some things that are going to activate that left side, activate that trunk, make sure that we're balancing our power, our explosiveness. Because dancing, you have to be very explosive. You have to absorb a lot of force when you're landing, generate a lot of force when you're coming up out of a land. It's incredible athletic feat to be a professional dancer. And they have a lot of sports related injuries. And we'll see the same kind of things. We'll worry about hip flexors, Achilles, patellar tendon issues. So a lot of what we'll do will be and a general strength and conditioning, but also involves some things that are going to help even out that balance, so we reduce the risk of having an overuse injury on the dominant leg later on down the line. Here's the last case I'm going to show you, and I hope that after looking at that, you'll see that this looks pretty darn good. This is probably the most normal, again, no such thing as a normal gait, but one of the most optimal gaits I've seen in a really long time. This is a professional athlete I'm currently working with. He's in an off-season training program. Previous history of a hamstring injury, like everybody else in the sport world. But as you can see from this power tracing at the top, we've got really great some consistency here. Bang, bang, bang. And the turn is at around that 6 second mark. And you can kind of see we have a little bit of a dip on the turn, but look how it recovers. And it looks almost identical. If you split this graph down the middle, we have um, absolute consistency um, um, left to right on striking and power. I'm sorry, striking and pushing force. Very symmetrical compared to some of the other ones we've seen. The stride graph, this is as close to um, agreement as I've seen, where the left is not really lagging that far behind. Here you can see how when you have the slope of the line at around that 0.5 seconds, you start to see a little bit of separation. It becomes a little bit of spaghetti, but it's pretty darn close. And if we look at the symmetry graph, those almost overlap. We do have a little bit of left leg. Again, we have a right dominant individual. So uh, really good agreement and that symmetry. If we look at the balance graph at the bottom, we'll see we have a little bit of a front lean, and we have a little bit of tilt to that left side, which is interesting because we're having a little bit of a lag on the left side, but we're kind of leaning in that side, and that would be the type of thing where I might think that this is maybe spending too much time on that limb because that's where the hamstring was. That we're kind of slowing that down. We're spending a little bit more time. We're leaning on that side because we don't quite trust it. So no symptoms, no pain, no anything. We're just in for off-season training. This is pretty darn good, but we do have some abnormalities that we can deal with that will integrate into training, not make a huge deal of them, but we know that they're here. There's some resiliency I can still build into this athlete, even though this is very optimal looking gait. If this individual left for the season looking like this, I would feel pretty confident that we did a really good job of getting them ready for the season, and not be too concerned with soft tissue injuries if they remained compliant with what our training program and philosophies were with them. Would be somebody. I'll talk about this when we do these screens, but this is what we would like to see in an athlete this time of year as they're going to start taking the field. Which brings me to what I was just going to talk about. When do we do the screenings? How often? You do a preseason baseline. That's the bare minimum. And again, we've always done that for concussion. I think we can do much better than that. If you're an athletic trainer or somebody's working with athletes like myself, I just love being around athletes, and every opportunity I have a chance to work with them and talk with them and help them stay on the field and then go watch them perform, and be the very best that they can be. I love to have those opportunities. So the baseline is not enough for me. There are some people, like the professional athlete we just saw. I may say, hey, every time they come in, say you see them once a month, hey, let's do it. Let's do a SportGait before you come in. But somebody that I have a lot of contact with, I'll do it weekly. Again, because I'm not just looking for this individual who I think I'm sending off into the season, or the dancer who I'm thinking sending off into her summer program, with some resiliency built in. I'm also looking for, are we going to have breakdowns? Are we going to get fatigued? What happens when we're in that if you're an NFL player in that fourth and fifth week where the bumps and bruises start to add up and you start to try to catch that second wind for the middle part of the season, where are we compensating there? So I like to do it at least once per week per athlete. Sometimes I'll do it more. If I don't have direct contact with them, it will obviously be less than that. But again, every chance you can get it, you have an opportunity to deal with an athlete. It's a positive place where you can make a positive impact in their life, particularly the younger athletes. And when you start doing baselines in August, if you're in high school or college and your athletes are starting to return, and you start seeing those indicators, don't ignore them, put them in your pocket and say, we'll worry about it if the inevitable or the unfortunate event you have a concussion. Um, think about the inevitability of a soft tissue injury happening with that baseline information. So if you see the yellow or the red, it's an opportunity to take a look, pull these tracings out, take a look at where the imbalances, asymmetries, fatigue, what is the cognitive pattern that you're seeing, and try to integrate those findings into whatever you come up with for your um, strength and conditioning program for your preseason and your in season. Again, turn this data into action. It's a opportunity for you like I say to athletes, what's the greatest attribute you can bring to your team, and that is to be available. And when you have an athlete that is available constantly, um, that is an incredible gift that you can give to your coaching staff. Um, and nobody, wants to lose athletes. If you're on a team, you have a role, no matter if you're a starter or not a starter. You get a lot of playing time, don't get a lot, but everybody has a role, everybody has a job, everybody's a contributor, and you really help the mindset of the team and the coaches when you have athletes who are functioning and available. It's an opportunity for you to really take that. One of the things, the second added targeted recovery, um, I you know we don't I don't like obviously they're built in. Off days are days to do active recovery kind of things, and some go for a swim, go for a walk. Sometimes if there's athletes who are really starting to show fatigue and breakdown or imbalances, um, they'll go home with the recovery program, and it's a really simple 5 to 10 minute routine. Again, with TBRX, a lot of what we do before we get into heavy lifting, or if we do heavy lifting, a lot of people think with TB12 and TBRX, it's just rubber bands, but those rubber bands are activating, and we're trying to get the muscles that we want to use activated before we go do things like hang cleans, or deadlifts, or whatever sort of compound exercise you're going to do. You can target that, and everything that we do is centered around the core. So if I want to do reverse lunges, I like reverse lunges if we're having overuse problems, because it takes a lot of pressure off of the um, a patellar tendon. But I think when you step backwards, it's also a little bit of cognitive dissonance too, that you're moving backwards and you're not really used to that. And I like to do it with a resistance band tied or anchored to something, the weight, or a dumbbell, something that uh, puts a distraction. And for me, the weight in those situations is not important. It's the distraction. I'm trying to distract the core, and the weight is forcing the core to pay attention to what it's doing, and we start feeling the force translated into the glutes and the calves and the hamstrings. And we need to really, cognitively focus on using our core. So that's what we like to do before practices, before workouts, before strength. We'll build in a little warm up routine. Like we'll have people who some of these gait tracings show us they have some glute issues, is where their power is coming from. We'll have a glute activation, hamstring activation, calf activation, and everybody breaks off into their own little group, does a little 5-10 minute routine, and then goes about what their strength and conditioning plan is. Core single leg work is a lot of what we do in activating those muscles to make sure that they're ready to do what they need to do, kind of waking them up. Um, Again, the symmetry is the advantage. If you have balanced athletes, they perform more efficiently, they're less likely to be injured, and they're more resilient under fatigue. If we could take that last athlete we looked at and take that and fast forward it to week 10, 12, 14 of an NFL season, this is someone who's not going, if we continue to use the program we're currently using, this is someone who's less likely to break down at the end of the season with non-contact injury issues. So the more symmetry we can build, the better athlete we can build. The more athletic that athlete becomes, the more athletic an athlete is, the more resilient they are. The more resilient they are, the less prone they are to injury. The less prone they are to injury, the more available they are. The more available they are, the better the mindset and morale of your team. So it's a it's a holistic approach to taking care of your athletes in more than dealing with just bumps and bruises. It's a chance for you to really make an impact. Final takeaways. Symmetry is a little whisper of hidden stress that will accumulate into more annoying, nagging injuries that, patellar tendonitis can be a pain in the butt to deal with. Um, SportGait helps me find those imbalances, not in a way that, oh my God, I'm gonna freak out, I'm gonna, scare the athlete, scare myself, and everybody gets worried. But it gives me an opportunity to say, hey, let's add this, let's add that. Let's have some fun with it. So here's a challenge for you. And a way to kind of gamification of what we're doing and show them, hey, look, you're a little bit weaker on the left side. Let's see if we can't get a little bit better on that left side. But how were you last week? You're still weak on your left. Let's go. So it's an opportunity for you to have some fun and really and get involved in your athlete and become a very trusted source for them. And using this data proactively or prospectively is really important, not just post-injury. I don't want to, and I'll do this with people who do have injuries. We'll monitor the gait and cognitive function as we progress through an injury, but it's a great opportunity to start thinking about how I can prevent stuff, how I can keep people, um, doing what they want to do. And that is the end of that. And if Beth wants to jump back on, and if we have any questions, I would be happy to answer them. We've gone over a lot of stuff in the last 3 weeks, so I hope that we've generated some questions. Hopefully, people have gone back and started using this and maybe you know, dove into some old cases or working with some athletes currently who are looking at this and looking at progression and how their interventions are working and coming up with new and creative ways to try to deal with some of these issues. But hopefully, we got some questions.
Nothing in the chat yet, but if anybody does have a question, I'm monitoring the chat right now. Drop them in there and we'll get them answered. So I'll keep watching for the next few moments to see if any questions come in.
We need to start planting some. We need to get some of our. We need to start planting some questions. Um,
Right.
get some response. I I just hopefully I don't know how many people are here and people might watch us on YouTube, but the story of using this app has really been transformative for me as a physician and as a coach. What started off as doing concussion baseline testing, and like everybody else, I saw indicators or something. Like, what am I supposed to do with this? Um, I started realizing that where the deficit was in the indicator was where I was seeing concussion deficits. And I started thinking about how can I? Is there maybe these things are maybe this is telling me something that I haven't been paying attention to. And so getting into the data and diving into it, has I think really allowed me to be a much stronger advocate and um, uh, health professional for all of the athletes. And I hope that some of you uh, find some inspiration to steal my ideas.
Well, no chats yet, Pete. So if we want to wrap it up, we'll be back next Wednesday, same time, same place. Hopefully, fingers crossed, no technical difficulties with Zoom again, but we will be back.
Hopefully. Thank you, everybody. Have a great holiday.
Thanks. Bye bye.